Well, you know, you get a headache, you go online to figure out why. Well, lots of us do it. I do it. In fact, the Pew Research Center says 59% of adults who use the internet have searched for health information in the past year. 35% say they've gone online trying to figure out what medical condition they or someone else might have. The problem is some of us overdo it. Some of us become obsessive about it. And that's a condition experts call cyberchondria. There's actually a name for it. Here to tell us more about it is Dr. Janet Taylor. As always, great to have you with us, Doctor.
Thank you. Thank you.
So it's kind of like if you're a hypochondriac and you have a computer, chances are you could be on the road to cyberchondria.
Bad combination.
Yeah, well, I mean, the thing to remember is we've all done it, and most people go on looking for information to make them healthier. But there are a few, almost 25% of people who will go on with a vague pain, a vague symptom, go online and be convinced that, you know, they're going to die tomorrow.
The worst case scenario.
The worst case scenario. So the issue is sometimes people self-diagnose themselves, which means they look for self-treatment, and they don't go in necessarily and see their doctor, or they go in and see their doctor too much. And the fact is they don't have anything diagnosable.
Okay, so with all of these potential places to go searching, there's got to be good sites and bad sites. What can you tell us?
Right. And the key is not to stop searching, because we are medical consumers and we need to be informed. But if you are going online to look for a site, you want to look and see who's managing the site. So institutions or government, for instance, mayoclinic.com or webmd.com. cdc.gov is great because not only do they have wonderful information, but they also have Spanish. So if you're Spanish speaking, it's easy to find out the information. You want information that's current and evidence-based, and most importantly, you want information that you can understand. So if you go on a site and it's hard for you to understand what they're saying, find another site, but one that's reputable. And you don't want to go on a site that asks for personal information or that you have to give a credit card or money.
And eventually talk to that doctor if there are questions.
That is the key. I mean, nowadays it is a partnership with your doctor. You can go in with information. I love when my patients come in with questions and they said they have found this online. But you also have to be willing to communicate with the doctor and have the doctor communicate with you, because at the end of the day, it's all about your health.
So, living with a few cyberchondriacs, I've just got a question. What's the real problem here? Is it the chance that you're misdiagnosing, or is it the stress that is created by looking at something and maybe perhaps thinking it's a lot worse than it is?
Well, it's a combination of both, because certainly with cyberchondria, the difference is how much anxiety you have, how much you think about it. There are some people who are so convinced they have an illness, they stop going to work or they stop having relationships. So it's about acknowledging the anxiety, but also the fact, if you're in doubt, go check it out. Talk to your healthcare provider and make an informed decision. Don't just diagnose yourself online.
Okay. Dr. Janet Taylor, thanks for being with us this morning.
Good info.
Thank you.
Yeah.